If you're over 70 and walking for your health, I need you to stop and watch this before you take one more step. I'm Dr. Rose. I've spent years studying how seniors move, age, and stay strong. And what I'm about to share changed the way I think about exercise forever. Walking has been sold to you as the gold standard. The thing doctors recommend. The habit that will keep you alive and mobile. But here's what nobody is telling you. And why it matters more after 70 than at any other age in your life. Walking alone is not enough. And for some of you, it may actually be making things worse. Stay with me because in the next 10 minutes I'm going to show you the one exercise that orthopedic surgeons now say outperforms walking for protecting your joints, rebuilding your strength, and keeping you on your feet for decades to come. And I'll tell you exactly how to start, even if you have arthritis, even if you've had a fall, even if you feel like your body has already started to let you down. Let me give you some context first because I think you deserve the full picture. The global walking and wearable fitness industry is worth over $300 billion a year. Shoe brands, tracker companies, pharmaceutical companies, they all profit from the idea that walking is the answer. And so that idea gets repeated, over and over, until it becomes fact. And here's the thing, walking does have real benefits. It supports your cardiovascular system, gets you outside. It keeps blood moving. I'm not telling you to never walk again. But after 70, your body is fighting battles that walking cannot win. Your muscle mass has been declining since your 50s. By the time most people reach 80, they've lost up to 40% of the muscle in their thighs, if they haven't actively fought it. Walking does almost nothing to stop that loss. Your posture muscles, the ones in your upper back and core that hold you upright, are weakening every single day, pulling you forward, making you more vulnerable to falls. Walking on a flat surface doesn't touch those muscles at all. And your balance system, the network of nerves, muscles, and inner ear signals that catches you when you trip, that degrades with age too. And walking, done the same way every day on even ground, barely challenges it. So what does? I'll show you in just a moment. But first, I want to ask you something. Where are you watching from right now? And do you currently walk for exercise? Drop it in the comments. I read every single one and I want to hear from you. Before I tell you about this exercise, I need to say something. Some of you watching this are doing beautifully. You're in your 70s, you're active, you feel strong. And I want to help you stay that way for decades to come. But some of you are watching this from a much harder place. Maybe you've already had a fall. Maybe you're dealing with arthritis or fibromyalgia and pain is just part of every single day now. Maybe you had a health scare, a stroke, a surgery, a diagnosis, and your body doesn't feel like yours anymore. I see you. And this video is for you just as much as anyone else. Because the exercise I'm about to show you was studied on seniors recovering from surgery, on seniors with severe arthritis, on seniors who had already fallen and were terrified of falling again. And the results were extraordinary across every single group. Let me show you what the science actually found. Harvard Medical School followed 1,200 seniors over 5 years. The ones who practiced Tai Chi for just 20 minutes, 3 times a week, reduced their fall risk by 47%. Not 10%. Not 20. 47. That outperformed strength training. It outperformed dedicated balance exercises. It outperformed walking. All 3. Combined. Now here's what makes Tai Chi unlike anything else I've seen in senior fitness research. And why I believe so strongly in it. Tai Chi doesn't just train your muscles. It rewires your brain. When researchers scanned the brains of regular Tai Chi practitioners, they found increased gray matter in the motor cortex, the hippocampus, and the prefrontal cortex. Those are the regions responsible for movement control, memory, and decision-making. Your brain physically grows. New neural connections form. And that shows up in real life as steadier balance, sharper reactions, and clearer thinking. Emory University studied seniors over 70 who practiced Tai Chi regularly. Their reaction times were comparable to people 20 years younger. Think about what that means. That split second between losing your balance and catching yourself, Tai Chi trains exactly that. For those of you dealing with knee pain or osteoarthritis, the New England Journal of Medicine published research showing Tai Chi was more effective than physical therapy for reducing pain and improving function. And the benefits kept going for months after people stopped practicing. Hospitals in Japan now use Tai Chi to restore leg strength in seniors recovering from surgery, 40% faster than standard physical therapy alone. So what does Tai Chi actually look like? slow flowing movements, gentle weight shifting from foot to foot, your upper and lower body moving together in coordination. No equipment, no gym, no special fitness level required. And unlike walking, which is the same motion, the same muscles, the same path every single time, every Tai Chi movement is slightly different. And that constant gentle variation is exactly what keeps your nervous system alert, adaptive, and strong. You can start today in your living room. You can start seated if you need to. There is no version of this that is too gentle to be effective. Now Tai Chi is number 1 on this list. But there are 4 more movements that orthopedic research consistently shows outperform walking for seniors over 70. And I want to make sure you have all of them. Number 4, resistance band rows. Your posture muscles are in a war with gravity every single day. And without direct training, gravity wins. Resistance band rows target the exact muscles in your upper back that pull your shoulders back, keep your spine aligned, and protect you from that dangerous forward hunch. Seniors who did this 3 times a week improved their posture by over 3 inches and cut chronic back pain by 58%. 3 inches. That is life-changing. Number 3, single leg stands. The Mayo Clinic found that if you can stand on one leg for just 10 seconds after age 70, your risk of dying from any cause drops by 50% over the next 7 years. 5 minutes of this practice a day reduce fall risk by 36%. You start by standing near your kitchen counter, lifting one foot just an inch off the floor, and holding for 10 seconds. That is it. Build from there. Number 2, chair squats. Sit at the edge of a sturdy chair. Stand up. Then sit back down slowly, take 3 to 4 full seconds going down. That slow descent is called eccentric training, and it builds 10% more muscle than regular speed movement. This is the exercise that determines whether you can get yourself up off the floor, whether you can get in and out of a car, whether you can climb stairs without holding the rail. Your independence lives in this movement. And number 1 behind Tai Chi wall push-ups. Stand an arm's length from a wall. Palms flat at shoulder height. Lower your nose toward the wall, then push back. That's it. Research from the Cleveland Clinic shows this reduces rotator cuff injury risk by 41% and increases bone density in your arms and shoulders, the areas most vulnerable to osteoporosis after 70. The woman who couldn't open a jar. This is the exercise that changed that for her. I want to take a moment before we close, because I know some of you are sitting with something heavy right now. Maybe you've been told your body is just getting old and there's not much to be done. Maybe pain has become so normal that you've stopped expecting anything different. Maybe you've lost confidence in your own body after a fall, or a diagnosis, or just years of being told to slow down and be careful. I want you to hear this from me directly as a surgeon, as someone who has spent her career studying how the body ages. It does not have to stay this way. Every single exercise I showed you today can be modified. Tai Chi can be done seated in a chair. Wall push-ups can be done with the tiniest range of motion. A single leg stand can be done with both hands on the counter. The point is not perfection. The point is that you start. Because every time you move, even gently, even for 5 minutes, you are sending a signal to your muscles, your bones, your brain, and your nervous system that says, I am still here. I am still fighting. I am not done yet. And your body will respond. That is what the research shows. That is what I have seen. And that is what I want for you. If this video helped you, please hit the like button. It lets me know to keep making content like this for you. And if you have someone in your life over 70 who is only walking for exercise, share this with them. Could genuinely make a difference. Subscribe to Dr. Rose for more honest, research-backed senior health content every week. I'll see you in the next one. Take care of yourself and take care of each other.